Good afternoon, ladies and gentlemen. I am Donald Redman, co-founder and chief executive officer of Advanced Medical Solutions International, AMSI for short. Whether you are physically here at the Hilton Hotel at the Palm Beach International Airport or watching remotely, welcome to West Palm Beach, Florida. To the media tuning in, I know your time is valuable, especially these days, and I thank you for giving this exciting announcement the attention it deserves. We have invited elected leaders of Florida, both at the state and federal levels, American health leaders, as well as international political and medical leaders to join us today. I am happy to report many are joining us virtually now. Before I get into the details of our amazing technology, let me introduce my associates. First, Dr. Adib El-Zubi. Dr. El-Zubi is co-founder and chief scientific officer at AMSI USA. He is also co-founder and head of research for our sister organization, AMSI Jordan, as well as the founder of Stem Cells Arabia, an R&D firm based in Amman, Jordan, with a 15-year track record of success. Dr. El-Zubi is a world-renowned medical researcher with his PhD in immunology from the College of Medicine at the University of Illinois at Chicago. Dr. El-Zubi possesses a wealth of scientific knowledge and in-depth experience in biomedical research, both in academia and biotech industries, garnered from the US and elsewhere. Next, we have Charles Delarbre, CEO of Santa Barbara Travel Bureau, Virtuoso. Charles is a world-renowned travel expert and will provide us today with insight into how the COVID hunter will benefit that hurting industry. Not with us today is Nobel Prize-winning molecular geneticist Professor Mario Capicci, an advisor to AMSI on this and our company's other breakthrough technologies. Professor Capicci is currently in residence at the University of Utah. His dramatic personal story and incredible professional accomplishments are reminders that anything in medicine and in life is indeed possible. Also, Professor Maria Grant deserves praise for her stem cell research at the University of Florida and the University of Alabama at Birmingham. Fortunately for us all, he will be appearing in a pre-recorded message in a few minutes. I want to call your attention to three very dire statements recently found in the press. The first is by Governor Cuomo of New York on January 11, 2021. In his State of the State speech, in which he said, quote, "Ramped up testing capabilities would be key to reopening the state's economy," end quote. The governor went on to comment that vaccine distribution might not be accomplished until late 2021. And that the economy of New York has to reopen urgently. If it stayed closed, he said, quote, "the state would have nothing left to open," end quote. The second statement, also just days ago, is from Dr. Soumya Swaminathan, the World Health Organization's chief scientist. Even as vaccines start protecting the most vulnerable, we are not going to achieve any levels of population immunity or herd immunity in 2021. She went on to say, quote, "Even if it happens in a couple of pockets and a few countries, it's not going to protect people across the world." And that confirmed that continued measures such as social distancing, etc., will be necessary. In other words, any return to normal is not going to be achieved in 2021. The last quote is the headline from the Washington Post article on January 21, just days ago, that reads, "Jobless claims at historic high last week as Biden inherits the worst job market of any American president." We at AMSI stand before you today to correct the statements made by the governor of New York and the World Health Organization, and to help President Biden relaunch the American economy. Reopening businesses and returning to normal this year is not only possible, but certain, thanks to the technology we are announcing today. They are wrong because up until now, the world has not known the COVID hunter.
Now to growing concerns about the deadly coronavirus.
1 million deaths from the coronavirus.
In many areas of the country, the hospital beds are stretched. People are running out of beds, running out of trained personnel who are exhausted.
COVID-19 has challenged our country in ways we never imagined. Jobs lost, loved ones gone forever. Testing and tracing methods haven't stopped the surge. Vaccination methods are moving slower than expected. Some say we could be over a year away from getting back to normal.
You don't make the timeline. The virus makes the timeline.
COVID-19 has canceled events, distanced families, and closed businesses around the globe. Until now. Introducing the COVID Hunter, a revolutionary detection system. Touchless COVID-19 detection for humans, objects, and air that works anywhere, anytime, up to 6 feet away. Rooms, objects, and people will be scanned with the COVID Hunter, making masks and social distancing obsolete. Returning life, your life, to normal. The COVID Hunter.
The final chapter of the global war on COVID-19 begins with these 3 words: the COVID Hunter. The technology in use in the video you have just viewed is unique to the world of electronics. Our American company, along with international partners, is offering a path out of this terrible public health crisis. Our commitment today is to mass produce this device and send it across the globe as fast as humanly possible. The end of the pandemic is closer than anyone has expected. As you saw in the movie, the COVID Hunter employs revolutionary technology that allows the user to see the virus immediately without needing to come in contact with the subject. The COVID Hunter allows humans and objects to be scanned for SARS-CoV-2 immediately. Let me say that again. The COVID Hunter allows humans and objects to be scanned for SARS-CoV-2 immediately. The COVID Hunter system would work like this: rooms, restaurants, venues, vehicles, hospitals, hotels, schools, offices will be scanned for the coronavirus and its evolving strains immediately. Wherever the virus is detected, it will be cleaned and retested to ensure the disinfectant was successful. Then any person or object entering the room will be scanned and immediately be shown to be clean or a carrier of the virus. A COVID-free bubble with persons and objects shown to be clean upon entering means social distancing, masks, and anxiety about catching the virus are unnecessary. Clean plus clean equals clean. And that, I'm pleased to say, would return us all to normal much sooner than stated in the previous 3 quotes that were just mentioned. We at AMSI owe a great deal to all the medical and engineering research that over the years has been taking place in the country of Jordan. King Abdullah has created an atmosphere for research in all of the human fields of medicine, unlike any other country in the Middle East. A group of scientists, researchers, and inventors in Jordan exclusively developed this revolutionary technology and utilized the latest scientific and medical knowledge to enable the detection of different strains and mutations of SARS-CoV-2, also known as COVID-19. As a thank you to the people of Jordan, AMSI will provide free of charge a sufficient number of COVID Hunter devices to help curb the pandemic in their country. For those who might be unfamiliar with AMSI, we have been conducting research for almost 7 years following the progress of a specific technology coming out of the University of Florida, Gainesville, and University of Alabama, Birmingham, in the field of medical studies for mammals, performed by Professor Maria Grant and her team. Her research has primarily been in the field of horses because they more closely mirror the type of treatments that are effective on them as well as, we hope, humans. AMSI has a history of making outstanding discoveries, including a cure for allergic airways disease and chronic obstructive pulmonary disease, otherwise known as COPD, that is currently in the preliminary phase of FDA approval. Our Jordanian partners are internationally renowned pioneers in the biomedical field, especially in stem cells, regenerative medicine, and bioengineering. Dr. Adib Al-Zubi and his team have achieved major milestones in diagnosis and treatment of a range of human conditions, including infertility, diabetes, and infectious diseases, as well as manufacturing innovative medical equipment. When COVID-19 quickly upended life as we knew it across the globe, we put our other developments on hold to concentrate all of our efforts on producing this device. Although Americans may not be accustomed to thinking about medical breakthroughs coming from the Middle East, I believe the COVID Hunter may change that view forever. At this time, I will turn the floor over to Dr. Al-Zubi to discuss from a medical standpoint how the COVID Hunter works and why it will allow us to win the war against COVID-19. Adib?
Yes. Thank you, Don. Good afternoon, everyone. I'm Dr. Adib Al-Zubi from Jordan, co-founder and chief scientific officer of AMSI, founding president of Stem Cells Arabia and Amman, Jordan, and a co-inventor on the COVID Hunter. Today, we are witnessing the birth of a new technology that will change how we detect SARS-CoV-2 that causes COVID-19. You see, one of the biggest challenges we have in controlling the spread of COVID-19 is that the virus has a very high rate of infection, while the detection methods, on the other hand, are old, such as PCR, are old, slow, expensive, and require tedious lab work. We at AMSI and Stem Cells Arabia aimed at attacking the virus by employing an immediate and highly sensitive detection method to deprive the virus of its high infection rate. So we are hitting the virus at its strongest point. The COVID Hunter is a new technology in the detection of SARS-CoV-2 that causes COVID-19. The science of the COVID Hunter technology is elaborate, breakthrough, and revolutionary by all means. This patent-pending pending technology utilizes a unique combination of light waves, sound waves, combined to hone in on specific physical, chemical, and biological characteristics of SARS-CoV-2. So we are basically surrounding the virus and characterizing the virus on all its characteristics all at once. Through focused research and tireless work, we at AMSI and Stem Cells Arabia analyzed and specified these physical, chemical, and biological characteristics of SARS-CoV-2 and used these characteristics as one single value to target the detection by the COVID hunter. The sum of these specific SARS-CoV-2 characteristics is not found in any other virus or any other target and constitutes a unique thumbprint of the virus. So this is a unique thumbprint of the virus that is not found anywhere else. We use that to be detected by the COVID hunter immediately. By using safe electromagnetic waves, including radio waves like those used in car remote controls and infrared waves like those used in TV remote controls. So basically this unit here uses these two waves, radio waves and sound waves. Both are safe. By using infrared waves and radio waves combined with a proprietary method for detection, we have been able to successfully detect SARS-CoV-2 in a safe, instant, and specific manner. Safe, instant, specific, and more important than all, non-invasive. I don't need to take a sample. In a way, to think about it from a different point of view, the COVID hunter visualizes or sees the virus in real time and gives the result in real time. You point, press this button, it beeps, virus is detected. That's it. That's how fast it is. You don't need to wait minutes for chemical reactions to take place. The COVID hunter technology was developed by a group of international scientists, researchers, engineers, and inventors, led by a Jordanian team. And here I want to take this opportunity to sincerely thank our inventors team for this great world-changing achievement. Thank you all very much for this great work, guys. The technology is owned by AMSI and was developed in collaboration with Stem Cells Arabia and Amman, Jordan. This technology is safe, accurate, fast, inexpensive, and easy to use. Inexpensive because you can perform thousands of scans per day. You only need to change the battery. That's all. No consumables to use here. The COVID hunter can easily perform up to 300 scans per hour. That's a lot. That's very fast. Just the time to scan, 5 to 10 seconds per object or person. This allows the scanning of millions of people daily by using 1,000 devices only. What does that mean in real life? You need one of this, one COVID hunter device only, used at a school or at a business or a company or a restaurant. You can literally open that school and scan all incoming students every morning and keep this school or business COVID-free environment. Those who are infected can go home, small percentage, but the rest can go to school. So we can literally open schools and universities and restaurants. On a larger scale, we can scan the whole state of Michigan or New Jersey, for example, with about 10 million population each, in less than a week. Less than a week. Can imagine the whole state of Michigan will be scanned less than a week using only 1,000 devices. We can scan the whole country of Jordan. The whole country of Jordan can be scanned in less than a week using only 1,000 devices. Let's go larger a little bit. If we have 100,000 units, only 100,000 units of this in place, in operation in the US, we can scan the whole population of the United States of America in 1 week. More importantly, we can identify those people who are infected with the virus and the other percentage, the other small fraction of those infected who are infective. So we can differentiate between people who are infected and people who are infective. All of this can be performed without taking any sample from the body or performing any lab work. Dr. Anthony Fauci once simply explained that not everyone who is infected with the virus is infective. What's the meaning? What's the difference between the two words? In other words, not everyone who catches the virus is a transmitter of the disease. So you can be infected, but you're not infecting others. Or you can be infected at the end of your infection, then you become non-infective. The COVID hunter identifies infective individuals who are spreading the virus from those who are infected but are not spreading the virus. What does this mean in real life? Identifying the small percentage of society who are infective individuals makes it easy to isolate them and stop the spread of the virus. We can literally stop the spread of the virus, while the non-transmitting infected can go back to normal life, go back to work, go back to school. Another level of complexity that we encountered with this pandemic early on, and we know it, and everybody kept hearing about it, is that a significant percentage of people who are infected with the virus are asymptomatic. Asymptomatic people who are infected but don't show any symptoms of infection. These people may be spreading the virus to healthy individuals without being detected, especially in the first few days after infection, where they cannot be detected by PCR. If you perform PCR tests on them, they can be PCR negative in the first few days, but they still have the virus. The COVID hunter can be used to identify these silent spreaders. We call them silent spreaders of the virus, allowing us to focus on stopping the spread of the virus before it reaches new, healthy individuals. On another level, after 1 year, we've been into this pandemic almost 1 year, right? After 1 year of human suffering, loss of lives and livelihoods, the only hope that we have today is vaccines. That's all what we got, vaccines. Vaccines work on improving human health by preparing and priming the human body before the actual infection takes place. The COVID hunter does not compete with vaccines. The COVID hunter complements vaccines. How is that? If it's a pyramid of people who are infected, the base of the pyramid represents people who are incoming as new infected individuals. At the tip of the pyramid is the small percentage of people who are getting very sick and are susceptible to developing complications. Vaccines represent the tip of the pyramid. Our device represents the bottom of the pyramid. While vaccines work on the human immune system, the COVID hunter does not work on the immune system. The COVID hunter works on the other side, on the virus itself, by identifying and stopping the virus from reaching and infecting new human targets. So we cut the base of the pyramid. No influx of new recruits for the virus. So you deprive the virus from reaching its new targets. Therefore, I don't have new cases every day. I'm just trying to get rid of the people who are, or trying to heal the people who are currently infected. Vaccines aim at decreasing the rate of death and decrease the incidence of complications in people who are infected with the SARS-CoV-2, whereas the COVID hunter aims at decreasing the rate of infection with SARS-CoV-2, thereby decreasing the number of new infections. Now, detection is the major problem with this pandemic. Regarding detection, there is a major difference between the COVID hunter and other methods currently in use for the detection of SARS-CoV-2, such as PCR and antibody tests. While PCR and antibody tests require sampling, performing chemical reactions in the lab, and tedious lab work, the COVID hunter is based on the immediate, direct detection of the physical presence of the virus inside the human body. So you're detecting the virus inside the human body without touching the human body from distance. You can click and you can detect the virus if it's inside the lungs or inside the throat or inside the nose or the nasal or the different areas of the body. If SARS-CoV-2 is present within the area scanned by the COVID hunter, an immediate signal will be heard or seen by the user indicating the positive identification of the virus. An additional and unique feature of the COVID hunter is the ability to identify and detect the virus outside the human body on contaminated objects such as door handles, mobile phones, and other objects. Why is this important? It allows us to immediately spot and identify and disinfect these objects effectively and properly and quickly. So during the past 9 months, our teams at Stem Cells Arabia and AMSI carried out extensive and elaborate series of experiments to demonstrate the specificity, sensitivity, and accuracy of the COVID hunter to detect SARS-CoV-2. So this device was put to the test extensively during the past 9 months. We manufactured and utilized several COVID hunter prototype devices to assure consistency and reproducibility of results obtained by these different devices. We then performed 2 types of testing. There are 2 types of testing. Testing of samples and testing of humans. First, the testing of nasal swab samples was carried out at a licensed diagnostic laboratories certified by the Ministry of Health in Jordan to perform specialized COVID-19 testing. These tests aimed at measuring the accuracy, sensitivity, and specificity of the COVID hunter prototype devices compared with PCR technology that's available for this test. Second, our team was granted an institutional review board called IRB approval from the Ethical Committee at the Royal Medical Services in Amman, Jordan, which is the highest medical facility quality-wise in Jordan, to perform testing on confirmed COVID-19 patients who are residing within the quarantine areas and in hospitals. So this is live test on patients. We performed thousands of tests on confirmed swab samples and on infected as well as healthy individuals, and the results were outstanding and were submitted to the US FDA here as part of the EUA application, or Emergency Use Authorization application, to approve this device for use later on. And here are our results. To demonstrate that the COVID hunter specifically identifies SARS-CoV-2 but not other viruses, we tested positive samples of different viruses, including SARS-CoV-2, the one that causes COVID-19, SARS-1, the old one, MERS, influenza A, influenza B, HIV, and dengue virus. The COVID hunter detected only SARS-CoV-2 positive samples and none of the other viruses, showing 100% accuracy to detect only, 100% specificity to detect only SARS-CoV-2 positive samples. We then tested more than 4,000 swab samples and compared COVID-19 results, COVID hunter results with PCR results. All PCR positive samples were detected by the COVID hunter as positive. So this device positively identified 100% of the positive samples as identified by PCR, showing 100% accuracy among PCR positive samples. On the other hand, this is addition. 4.8% of PCR negative samples were identified by the COVID hunter as positive, indicating superior sensitivity of the COVID hunter over PCR. Additionally, on human subjects, we tested more than 1,000 human subjects with the COVID hunter. Our results showed that all COVID-19 confirmed cases were detected by the COVID hunter as positive, showing 100% accuracy. Interestingly, 4.7% of PCR negative but are COVID positive. These are PCR false negatives. Human subjects were identified as positive by the COVID hunter, again showing superiority of the COVID hunter to detect patients who were diagnosed as PCR negative. Here is a unique application of the COVID hunter. Out of 76 out of 94 confirmed positive individuals. So these are confirmed positive individuals. They are infected with the virus. 94 tested. 76 out of those 94 were shown to be infective. How do I know they're infective? How do I know they're transmitting the disease? The virus was detected in their cough or sneeze or air exhaled from the mouth or nose and caught in a plastic bag or a plastic container. And we detected that immediately. So you make somebody cough in a plastic bag and you scan that bag. And you can detect the virus in air inside the bag or the container immediately. Demonstrating a unique feature of the COVID hunter to identify infective individuals or spreaders of the disease. Further, using the COVID hunter, thousands of objects were scanned for contamination with the virus, and contaminated objects were successfully detected and properly decontaminated. Of significant importance to the scientific community, especially to scientists and researchers working on COVID research. So those of you who are working on COVID research all over the world, listen to this. The ability of COVID hunter to track the mood of transmission of SARS-CoV-2 and its tolerance to environmental factors was tested. So we track the virus as it moves from hand to mouth to other people and goes from one object to another, and we subjected the virus to environmental factors, temperature fluctuations, and we measured that with the COVID hunter. Our team was able to show with high efficiency how the virus is transmitted from an infected person, so this is an infected person, while coughing into their hands, and then shaking hands with another person with clean hands. And that other person with clean hands touched a door knob. Then after that, touching a mobile phone, then touching a car. And we went with the virus as it goes from one object to another immediately, and we showed that this healthy individual, by shaking hands with an infected individual, can transmit the virus to a third party without even being infected. This is the hallmark of this virus. Well, this is why this virus is causing such pandemic, because it has a high rate of infection. And the only way to stop it is by tracking this and stopping it. So we are trying to stop it from going to a third party to a second party. Additionally, our team was able to discover the virus on the hands and feet of uninfected domestic pets. So these are animals, demonstrating how animals can be silent transmitters of the virus from person to person within the same household. So there was a dog that was going from child who's infected, touching, and going to an elderly and touching, and the dog, we detected the virus on the hands and legs of the dog, but the dog was not infected. In summary, our results showed that the COVID hunter can immediately and accurately detect SARS-CoV-2 inside and outside the human body with high reliability and ease of use. I am personally excited to see the COVID hunter go from the current prototype phase to a fully refined, manufactured device that can be used to save lives around the world. This is the time to save lives and stop the spread of this pandemic and gain our lives back. I strongly urge my scientific colleagues in all fields of science and engineering all over the world to put the COVID hunter to the test. Put this device to the test and test it. And we need to work together as one team worldwide to advance our collective human knowledge about this virus in order to gain the war against this virus. With this, I conclude the presentation of our scientific data and research on the virus. I would like to thank you very much, and I would like to introduce Mr. Charles Delabre, CEO of Santa Barbara Travel Bureau Virtuoso. Charles, would you like to offer your thoughts on the COVID hunter and how it's going to save the world? Thank you.
Adib, thank you very much. So a little more than 11 months ago, I was in Miami for the christening cruise of Regent Seven Seas' new ship, the Splendor. That was about 6 weeks after the little reported first case of COVID-19 infection in the US. Interestingly, by March, COVID was confronting the cruise industry front and center with predictions of losses in the hundreds of millions, but with the now optimistic prediction of a return to normal operations before the end of the year. How wrong everyone was. The travel industry, among others, has been decimated by the response to COVID. Many countries have closed their borders to foreign travelers, and many will remain closed for much of this year. When Don Redman reached out to me nearly 5 months ago with the information on the COVID Hunter, I immediately recognized how useful it could be across a spectrum of industries. Cruise ships could check all crew, passengers, as well as luggage and supplies coming on board for the presence or hopefully the absence of COVID. All spaces on the ship, cruise quarters, public spaces, cabins, suites, decks, could be scanned in the same way to ensure that the ship was a COVID-free bubble. The same can be done for hotels, airplanes, movie theaters, live performance theaters, film and television sets, restaurants, stores, and boutiques. In short, anywhere people might come into contact with one another while carrying on what used to be normal daily activities in the pre-COVID world. You get the picture. Over the past several months, I've reached out to decision makers in the cruise and hotel industry, the film industry, and to theaters featuring live performances who have been shut down now for over 9 months. The response from them was overwhelmingly positive. Many call the COVID Hunter a potential game changer, and a number of companies have expressed their intent to become customers of the COVID Hunter as soon as it is available. It is therefore especially exciting for me to be here for this press conference. I witnessed firsthand the hardship the COVID pandemic has created across so many industries, including my own. At the same time, I'm impressed by our resilience, not just the travel industry, everyone's, and the inventiveness by our dedication not only to recovering, but moving our industry forward. We've gone from knowing very little and being unable to predict an outcome to now gathering the tools to overcome COVID and get back to normal. I want to thank Don for bringing me into his team. This has been a great pleasure and a great honor. Thank you.
Thank you, Charles. Allow me to finish the announcement with details relating to the next steps. Yesterday, our FDA consultants, Biologics Consulting Group, Inc., submitted an emergency use authorization request to the FDA. Because the COVID Hunter is a critical weapon against the pandemic, and the demand for the technology will be unparalleled and immediate. AMSI is taking initiative by arranging production plans while simultaneously working with the FDA to secure necessary authorizations. At present, production will begin in Mexico and in the Middle East in the immediate future. We are proud to announce that through Dr. Diaz, we will begin production of this device in the duty-free zone at Ciudad Juarez, Mexico, in the very near future. Lastly, with such a massive demand for the COVID Hunter, the question becomes, who will be the first to receive the device? Frontline healthcare workers worldwide are the leaders of the fight against the pandemic and must have access to the supply of this product at the outset. Their fight is our fight. The COVID Hunter technology will go also to the heads of governments worldwide for immediate positioning in their respective battle against the pandemic. Once the medical community is taken care of, our focus will be on small businesses, specifically restaurants in the US. Sports leagues such as the NFL, Major League Baseball, etc., enjoy a tremendous amount of revenue from bars, restaurants that subscribe to sports channels. One concept would be for COVID Hunters to be given to sports leagues in exchange for a portion of their league's revenue. Those proceeds would be used to purchase COVID hunters for the struggling small restaurants and bars that end up paying for the channel's subscriptions. This system has the potential to save hundreds of thousands of small businesses by allowing them to create COVID-free bubbles at their restaurants. If successfully organized, this could be the largest privately funded, privately organized economic stimulus package in world history. It would also demonstrate that in times of need, citizens do not need to exclusively rely on the government. Now I would like to transition to question-answer period for members of the media, but first, please welcome a virtual visit from Dr. Alejandro Diaz Villalobos, immunology and allergist specialist and delegate of the World Organization for Peace.
Hello, guys. I am Dr. Alejandro Diaz. I'm a pediatric allergist, immunologist, global health specialist, and an immigration doctor. I have the amazing opportunity to go to Amman, Jordan a couple of months ago and witness the COVID Hunter amazing technology, both used in humans and in PCR samples. I was blown away about what I saw there. I've been a physician for over 30 years and I have ever seen something like this. I am very pleased to announce that this day is historical here in Mexico City because my friends from Amman, Jordan, my friends from the United States came here to create and sign an agreement and a joint venture to produce the COVID Hunter here in the state of Chihuahua. I am very pleased to announce this and very happy because I know as a physician, as a scientist, that this will be a before and after of this horrific pandemic. This will be a game changer. Thank you so much.
Great. So we'd like to finish today's press conference by answering questions from the media. For those who are watching online, you can submit your questions on your screen. And for those of you who are in the room with us, please use the microphone here at the front of the stage. I think we already have a few coming in. Our first question, Don, what makes the COVID Hunter superior from current detection methods? Or is that Adib? Sorry.
I think we'll let Adib, the scientist, answer that.
Okay.
Indeed.
What makes the COVID Hunter superior from current detection methods? The COVID Hunter detection methodology is totally different than what we have today, such as PCR and antibody tests. While PCR and antibody tests depend on chemical reactions in the lab, the COVID Hunter depends on the physical presence of the virus, which is immediate. That's number one. Number two, it's fast, immediate. Number three, it's safe. Number four, it's non-invasive. And most important of all is the accuracy rate. This device does not miss the virus if it's present. Again, it detects the virus with high accuracy rate, safely, remotely, non-invasively, but more importantly, inside the human body and outside the human body. This is the first time that we can detect the virus outside the human body on contaminated objects, on the hands, anywhere, immediately without performing any reactions.
Thank you. Yes, sir.
Just on the FDA, you guys mentioned that you've already submitted to the FDA. What are your hopes and how close are you to the FDA actually looking into approving this product, and also other FDAs of other countries, other authorities of other countries? Have you guys been able to obtain kind of green lights from them as well? Thank you.
You want to answer that? Because you've done the Jordanian ones and
Yes.
also the others.
Yes. So as far as the US FDA application is concerned, we submitted all the data we have so far. Please remember, we are still in the phase of prototype devices. We did not finalize to them finally refined manufactured units yet. So we are starting with the US FDA, EUA, the emergency use authorization, which is fastest way to get this approved, especially this is non-invasive method. So we just submitted this application with the US FDA, and we're going to submit this to the Mexican FDA, to other FDAs, to the Jordanian FDA, and to other FDAs of the respective countries, especially in countries where this device will be manufactured, to go first. And then we will go from there around the world.
Great. Don, we have a question about the pricing of the device.
Good question. We are, as Adib has said, we're still in prototype. The manufacturers, we have quite a number of companies in our assorted group that we've already established relations with looking at the device. They have the bill of materials, diagrams. They will be getting us pricing within the next 2 weeks, costing basis. But from what we know, we anticipate the price of this unit will be approximately $2,000. Now, what you want to remember when you look at the price of this unit is you're buying one unit. It will have multiple uses. It will be initially designed to capture the COVID-19 virus, any mutation that comes that would change the spike protein or the RNA. We can, in a very quick time, we can change that. We can put that on, in the more advanced models, on our cell phone app. And this unit will be fed from satellites with the new specs on the mutation and will be instantly able to detect that virus. So what we'll be doing is we'll be stopping the virus before a pandemic. And these viruses are ever changing. And don't kid yourself, they're changing rapidly and more dangerously, just as the one in Brazil just now. It's leaving everyone questionable. The nice thing will be the life of this unit is 5, 10 years or whatever. But as virus begin to develop and change, whether it's in 2022 or 2023, this device around the world will be ready to be charged and watching for them, all right? We anticipate production after our costing will be starting to flow within 6 to 7 weeks. That will give us from now until into summer to start getting large volumes of the product available into the market. So by the time we reach the depressing period of 2021 winter, like we're having it now with the terrible spikes, et cetera, our equipment will be there to answer the need. Adib, this one? Oh, sorry.
I have a question, yes. I'm Lenny Sue Paul with WPTV and WFLX here in West Palm Beach. So you're thinking this summer as a potential timeline for rollout, all depending on approval. And then when did conversations start to develop the COVID Hunter?
I'm sorry, and what was the last one?
When did the conversations start to develop the COVID Hunter?
When did the conversation start for our development? Well, Adib can better answer that one because it all originated there with my funding going in for various other projects.
So when this pandemic started growing a concern of healthcare professionals worldwide, we sat down with our teams at MSI and Stem Cells Arabia, and we sat down with our inventors and engineers and scientists, and we saw things going south. We expected back in March the whole pandemic, and we put like timeline of things that's going to happen. So we knew this is going to go bad. We really knew it. And we know from the genetic map of the virus, there are certain things that we know things will go bad. So we decided we wanted to go into another route. We said, with movement of people, the virus will be moving, right? So virus moves within people who are infected. So how can you detect a person who's moving? You need something fast. The hallmark of this virus that it is very fast. As I explained to you, somebody sneezing their hands, shaking hands somebody else, they can go and touch somebody else, a third party, they can transmit the disease to multiple parties within minutes. How can you catch How can you catch a virus that's moving so fast? Current methods don't work in catching the virus in good time. They're good for slow, but they're slow. So we thought about a very fast, and it has to be accurate too at the same time. But fast and accurate has to come with also a price. Usually they are invasive. We wanted something non-invasive. So we thought about physical characterization or identification of the virus, not chemical, because chemical means reactions, meaning time. Physical means quick. You just point and find, just like the temperature thermometer. You look at it and it gives you the temperature right away without doing anything invasively. So we thought about something like this. Number two, we wanted something that can be changed and modified and upgraded and updated as new variants are coming. How did we know back in March of 2020 that there will be new variants coming? Because this is an RNA virus. RNA viruses such as influenza, such as coronaviruses, are highly mutating. So they will be mutating at very high rate. You need to catch up with this. Vaccines can't catch up with this in real time. Vaccines will help in decreasing the rate of death, but they will not be able to stop the pandemic. So we want something that can be upgradable and can be updatable. So we came up with this device. Physical detection, immediate, non-invasive, quick, accurate. And the third thing we found out that it has to be portable. It cannot be, you cannot have a big machine as big as this room going with you everywhere you want to detect somebody. We want it to be ready at the airports, train stations, stadiums, cinemas, houses, schools, factories, companies. It has to be portable. So it has to be small. And that's how we came up with this innovative idea, thinking outside the box, thinking of about a different way to catch the virus by going faster than the virus. Thank you.
Thank you so much.
If I may add also, what we did at that particular time when Dr. Adib came up with the concept, we put on the shelf our other projects that we were developing, and we took all the funding coming from AMSI USA, focused it into AMSI Jordan on that project. And we were able, with those funds, that technology, the brilliance in Jordan, to produce this device that you have seen in 6 months.
Yeah, when we started in March, actually in three months.
Really, so it was even shorter.
The first, this is the probably 6th prototype. The first 5, I mean, the first one looked really funny. And we need, and Don Swat say, Adib, I'm not going to be able to talk about that. But it did the job. It was able to detect the virus, but we needed to keep working and working to add more options until we reach this. And I'm sure the new ones, as they are manufactured, will be with more and more options. Okay?
Yeah, one of the options that you can load on is to detect the norovirus, correct? Which is a big scourge of the cruise industry, important in South Florida.
At this point, we are concentrating on COVID-19 because of the urgency for this virus. But this can be used to detect other viruses once we get the physical, chemical, and biological characteristics of these viruses, get the samples of them, work on them, analyze them, decipher the code, and then we work on them and it will be done. Yes, it's doable.
Great.
Also, another thing that we can do, this unit that you see here is our first stage. It's the Model A. In a few months, we'll have the Cadillac limousine, so to speak, because this technology can be put in the detection systems at airports, at stadiums, etc. People will simply walk through and it will spot them right at that moment. So we'll be able to handle large crowds, very large crowds. We know now at the moment that we could do for the NFL a stadium of 60,000 people with 35 devices. We could do that stadium in 1 hour and 15 minutes to 1 hour and a half and have it packed with 60,000 people, a complete bubble, free of COVID. Everyone drinking their beer and hot dogs and peanuts and elbow to elbow and cheering and no masks, nothing. That's what entices the sports industry so much. It's always the massive crowds that bring the great revenue. And from that is what we want to pull a certain amount and give back through the stimulus package I just mentioned.
Thank you so
Thank you.
How does it work for lay people? How does this device detect the virus? How does it work, more or less? If you can explain it in lay terms, not so scientific.
Okay, so the gentleman back there is asking how does this device work in layman's terms. So the device sees the virus, and we told the device and educated the device to detect these characteristics all together in one place. If these are found in one place, it will give a signal, either a visual signal or a beep, for example. And if it does not find within the area scanned, how big is the area scanned? You can scan, this will be scanning like a linear line. You go up and down, just like the scanner of the barcode scanner at the supermarket. Same thing. This is in concept. Let me give it to you in something that you can relate to. This is in concept, combining your car remote control together with your TV remote control. This one is emitting infrared, this one is emitting radio frequency. What's the difference between the two? Car remote control can go through walls. You can be sitting here and turning your car, making the alarm on your car. But TV remote controllers have to see the TV, and they have a distance limitation. So there is light waves, sound waves that can be really programmed to detect a specific target that you pre-specify. You pre-specify only if you understand what that target is. We looked at the virus and we predetermined this virus before programming this device. Without understanding the virus, physically, chemically, and biologically speaking, you cannot target. You cannot be able to use this device.
Let me add something to what Adib said, because he always says it, and that's appreciable. He's a scientist. I'm a businessman, so I don't quite think like he does. Let's look at it more simply. You have the problem of a needle in a haystack, all right? What's the difference between the haystack and the needle? The needle's metal. So you devise something that can see the metal, and you will immediately find the needle in the haystack. How's that for simplistic?
Yes. Another question or no? Okay, do we have another question?
All right. Well, thank you all very much. We appreciate your coming. We're available for further discussions at any time. What you do want to go to is our website, the covidhunter.com, and there you can leave messages, you can be updated on the technology, and you will know how to reach us. All right? Thank you all for coming.
Thank you very much.
Thank you.